Okay, so good afternoon, everyone. My name is Tsu-Yin. I'm the Director of Center for Health Disparities, Innovation and Studies, Professor of Nursing at Eastern Michigan University. Thank you so much for joining us on this lovely fall Saturday. Earlier in June, our center hosted a virtual town hall, and it is apparent that during that time, people share with us that anti-Asian racism and hate is a prominent concern for Asian communities. According to a national coalition, Stop AAPI Hate, since the outbreak of COVID up to August 2020, there were more than 2,500 reports of anti-Asian nationwide. And during this 21-week report, show a very clear trend. There has been consistent occurrence since the outbreak. 7 out of the 10 incidents involve verbal harassment, including racial slurs, name calling, while shunning the deliberate avoidance of AAPI consisted about 22% of these incidents. And most of these incidents occurred on the business, about 38% of them. 22% occurred in the public streets and 11% in the parks, and followed by online incidents. While Chinese were the targeted ethnic group, most of the respondents were actually non-Chinese. And the report also finds that females were 2.4 times higher than male during these incidents. And when we look at the youth statistics, there are about 341 reports for anti-Asian discriminations involving youth nationally. And this, it consists of the 16% of that 2,000 some cases. And for the discrimination, the types for the youth, 82% reported they're being bullied or verbally harassed. 24% of them face some shunning and social isolations. And very sadly, we saw 8% or 24 physical assaults being reported. And for the youth incidents, they were reporting 16% of them were happening in schools, and then public parks, then online. And again, for the youth report, we saw girls were 2.5 times higher when reporting these incidents than boys. And I think the other alarming statistic is that 85% of 1,000 youth being interviewed by this organization, 85% actually show anger toward these rhetoric and also the emotional negative aspects. So today we are here, gathering here, that we are very happy to have you to join us. We're hoping we could have a honest and safe place to start the conversation and dialogue. Because even though here in Michigan, in this national report, we comes in about 23rd, and 15 incidents or cases were reported. However, that we know that our students and our youth and still encounter these incidents, and that's why we are here. We hope today's session could provide a safe space, and information presented today will empower everyone to interact with a larger community as a whole with the skills and strategy to deal when such incident arises. We also hope our teachers, school administrators could continue support, empower AAPI students. So to promote the interracial, intergroup relationships and a sense of coalition and solidarity. We know collective actions grant people strength to improve their lives and may attenuate the effects of minority stress. So today here in the first part of the sessions, we're going to assign all of you into 4 groups in the breakout rooms for role play scenarios. Then each group have about 13 minutes. And after 13 minutes, each group will report back to the overall group. And then we are moving into the second part where we have very 2 expert clinicians, Vicki Washington and Catherine Houston. They will present mental health aspect and first aid strategies. So without further ado, Miriam, are we ready to go into 4 breakout rooms?
Yes. So I'm going to open up everybody. Let me just make sure that the breakout room, 12 minutes. And I'm opening it up. Let's see.
Okay, so when you see that join breakout room, please hit that box. That fast. And I'm sure you could have another 13 minutes, but I cannot wait to hear about each group and what happened in each of their breakout rooms. So I'm going to invite group 1, breakout room 1's, I believe Amechi and Anna session to give us a kind of report on their group.
Yeah, so hi everyone, my name's Anna. So our scenario was on, there was a dad and his daughter. They were going to the store, they were Vietnamese, and then another guy in the store kind of came up and said like, hey, you brought the China virus, go back to where you came from, you ruined my country. So we talked about the 4 steps and like what we would do, and we also had conversations about like kind of like being a bystander. Sometimes as a bystander, it's actually easier for you to step in to kind of like question them, like interrupt them and ask like, hey, why did you say this? Where did you get this from? And another one was like another question, like conversation starter that came up was like, as the 2 people, right, in that video, as the dad and the daughter, like what should you say, right? Because sometimes you don't have a bystander and it's just you. So we kind of talk about like we can use the same strategies, but sometimes it might just take us like a minute to kind of react to what was being said. And so another really good one that Ursa brought up was like you can just say I'm American too, you know. I think for a lot of us, we were born and raised here too, so we're like as American as other people as well. So yeah.
Very good, thank you. Let's hear group 2 from Roland and Vicki.
Hello, everyone. Are you there, Roland?
Yeah, I'm here.
Go ahead.
Yep. Well, I think we had a good discussion about actual encounters that occurred, and I actually think that it's better to hear from Kelly or Bo with respect to what they encountered and their reaction to it, and make that sort of an example of how to cope with the racism that they heard.
Bo, you're on.
Oh, hey, I guess I'll contribute. So I was just talking with my friends, and a guy approached me. We sat down, talked for a while, and suddenly he asked me if I have coronavirus, and he kind of giggled a little, and he thought it was a joke. At first I was kind of in shock, but I told him, no, it's not a joke, it's not funny. And I think I also tried to let him know that, hey, that is very not nice, you know, like not a race does not define a disease specifically. And I think Kelly also has something to say as well.
Hi, yeah, I'm Kelly, and so in our discussion, pretty much, so we went over the 4-step process for speaking up against bias, and our scenario was a girl was watching a TikTok, and it was like a voiceover of Donald Trump, and he was saying like racist remarks about the virus and like calling it a China virus. And we like discussed some of our own experience that we had encountering racism, especially with regarding COVID-19. And I think what like I really got out of the whole discussion was just making sure to like correct people and like stepping in, and not only just like with racial slurs, but also like making sure everyone wears their masks, and just and like the 4 steps, I think it was just like mentioned that like silence kind of is sort of like it allows them to continue. So like just making sure, or like silence sort of gives them consent. So it's just important to just make sure like you correct them and step in.
Thank you. Thank you, Kelly. That was a good summary. A couple of, just really quick, just a couple of things. There were some general themes in the discussion that the participants brought up, and the general theme was feeling attacked from the information that's out there in social media, reacting in anger, and really needing to be mindful of that reaction so that they don't speak before they think, and then hesitance to say anything. So those were some general themes that came out of the discussion.
Thank you. Thank you, group 2. Very, very informative. Group 3, I believe, is Dan and Joseph. It's your turn now.
All right. We had some technical difficulties getting the sound going with our scenario, but as a recap, Dan gave it well. There were 2 girls, and one girl was catcalled on the street, and that girl was approached by another woman that touched her hair. The girl that was approached, she was biracial, Asian and Black, and the girl that touched her hair went on to say, oh, assuming that she was from Detroit, that her hair was like Cheetos because it was kinky and dry, and that she couldn't afford any shampoo or conditioner for her hair because she assumed, since she was Black, that she lived in Detroit, when in fact she lived in West Bloomfield, which is actually considered a more affluent community. And this addressed the topic of intersectionality, while the 3 other rooms dealt mostly with COVID-19 and how the APA community has been discriminated against because of the association with COVID-19 being the Asian virus. Intersectionality was the point that we have many different identities and we can experience discrimination based on different levels. So for the example, young girl in the video, she's Black and she's Asian at the same time. So she has to deal with these 2 different angles that she could be discriminated against. And not only because maybe she carries the coronavirus because she's Asian, but also having the different stereotypes associated with her because she's also Black. So Daniel, if you want to take it away.
Yeah, absolutely. I'm just going to put this short in here because I would like for the students to kind of like share in what they learned from that. But the biggest thing that I was stressing in there that with the intersectionality is a phrase called misogynoir. Misogynoir is a type of sexism that is very specific to Black women, because with Black women, they deal with, and in her case, because she's half Asian and half Black, she's dealing with multiple intersections. But misogynoir is combining not only with, oh, you have kinky hair, you must not afford shampoo, that scenario, but also if she started raising her voice, oh, you're getting angry now, you don't have a right to be angry. So it's a very specific type of sexism that is dealt with very specifically Black women. And we wanted to make sure we highlight that with this intersectionality, like Joseph was saying, is that even within our Asian communities, there's multiple different identities. And it could go even farther if we want to talk about orientation and gender.
Thank you. Thank you. This is a very rich kind of discussion. So we're going to move you into group 4 breakout rooms. Richard, can you take away?
Yes. So our scenario was a middle school setting, and so we didn't have a video to play, but it was and we forgot to mention to our group that it was a true situation. So there's a 13-year-old boy in class, he had a cough, and teacher asked him to go to the nurse. And he said, that's fine. I just had a quick, like small cough. And said, oh, I'm not taking any chances. You should go see the nurse. And he felt discriminated against. And so in our group, we went over the, the 4 steps, and then we kind of did a role play. So a little acting for Dr. Wu and I. And then what would you do in that moment? And so I think it was mentioned earlier, it's important, I think that that we often get caught flat-footed when these things happen. And it comes and goes. And then really that first step of interrupting is important. So before you can let the lesson continue or whatever continue, and you can make sure that's not normalized. So make sure you stop it. And so then what would you say? Is it was just kind of a role play chance to practice for people to apply the 4 steps.
Great, good. So I think we covered quite a few different scenarios, and people have different responses using these steps, or additionally other strategies like intercept. And I like where Amber or someone said silence is some sort of a consensus and consent that you allow this to happen. So that's why we want to continue empower our communities or any bystanders that to kind of stepped up. And again, the collective actions that, this is not only AAPI issue. This could happen to other racial ethnicity groups, right? So we really want to be coming at solidarity. Thank you all for contributing to this very rich dialogue and discussion. And I'm going to introduce my colleague, Professor Vicki Washington, and she's an expert in adult psychiatric nursing, and Dr. Houston, Catherine Houston. She's specialized in adolescent health, adolescent mental health, and they're going to take away for the second portion to provide very informative information and the strategies that, for all of us. Vicki and Catherine.
Dr. Wu, for that kind introduction.
Thank you. So I will share my screen here because we have a PowerPoint to pull up for this. And then let me just do slideshow. All right, can everyone see my screen?
Yes.
Yes.
Thank you. All right, so as we were introduced, my name's Dr. Catherine Houston, and then Vicki, do you want to introduce yourself again?
Vicki Washington.
And we're a psychiatric mental health nursing faculty at the School of Nursing at Eastern Michigan University. So we'll just provide a brief mental health information session since this, directly ties in with those information that we were discussing in the breakout room. So this is just a brief overview of what we'll be talking to you about today. So we have a few introduction questions just to kind of have us start thinking about mental health. And then I'll go into adolescent mental health symptoms to be aware of. We'll provide some mental health first aid, and then we will discuss how adults can help adolescents with their mental health. So to start off, just some discussion questions that hopefully people can just share your answers to out loud, or you can use the chat room. Are first, what are your thoughts and feelings about mental health? Do you have any bias or stigma around mental health, or do you feel comfortable talking about it?
And if you have participation on mute, so you can talk to us. There you go.
Like for me growing up, like talking about mental health were like mostly not encouraged. Like it was like just like it seemed like people around me like just talked about saying it's just complaining instead of like taking it seriously.
Thank you for sharing that. That sounds like it could be a little frustrating, not being able to talk about it, but I hope that there is less of a stigma around it now, and that talking about it can actually help us, and improve our mental health. So thank you for sharing that. And then how has mental health had an impact on your life? this is a bit of a similar question to the first one. You know, do people know people in their lives? Oh, sorry, go ahead.
Okay. I think being an Asian American is definitely a factor of mental health issues on a lot of the people in like our community. So I would say that because I grew up in a relatively like white populated community, I was really struggling with my mental health in those terms, like because I was unable to distinguish the kind of how I could be both Asian and American. And I think that that was like a major factor in why a lot of my mental health was declining.
Thank you for sharing that. That definitely is a very unique perspective, and that does actually kind of tie into this third question we have, which are just what are some recent experiences you've heard of or experienced that haven't had an impact on your mental health. So has anyone had any similar experiences to that, or, you know, tying into COVID, any other experiences you've heard of with that, or, you know, social media, anything like that? Can anyone think of anything that they've experienced or heard of from their peers?
Oh, here's one. Go ahead. I was just going to think, I was looking at TikTok. I was telling Daniel this the other day, but there was an Asian American TikToker that talked about how he was discriminated against during the pandemic, you know, people saying that he had the coronavirus. And he put up a video of how Congress went to go vote if anti-Asian racism should be condemned in the United States. It wasn't for a bill or anything, it was just to condemn it. And he saw how the bipartisan, the two-party system worked against him. All the Democrats voted that we should condemn that, but only I think 20 or so Republicans voted that we should condemn it, and the rest of the party did not condemn anti-Asian racism. So he was mentally affected by that so many people did not recognize that Asian Americans were being discriminated against during the pandemic. Oh.
Wow, that's...
It really made it about politics,
Yeah.
not.
Well, I mean, right now, since it is political season, that's a lot that's on TikTok, at least for my TikTok. I don't know how everyone else's algorithm is. I used to be about babies, but now it's all about politics.
Wow. Yeah, I kind of similar to TikTok. Oh, did someone else want to say something else, an experience they've had?
I was just going to say, going along with that, it seems like human rights issues are so politicized now that like it's affected my mental health, and I consider myself kind of a bystander, and still all of the hatred in this country has definitely affected me.
I'm a teacher, and seeing our students' mental health with online learning or hybrid learning or whatever situation they're in just really takes a toll as a teacher, not being able to do much because we're supposed to shove the academics down, you know, their throats, when social emotional learning should be like a priority right now in our states.
Yeah, that's another excellent point. Thank you about that. You know, that social emotional aspect is also very important to keep in mind. And similar to the TikTok experience, I know sometimes on Reddit, I'll just read story upon story about, you know, racism that someone's experienced due to coronavirus. And so, you know, I do read a lot of those stories on Reddit, and it's just very eye-opening to hear about. And I think all of those experiences can have an impact on mental health. And so that's why we kind of wanted to get this discussion started, just to have people think about all the different things that go on that can have an impact on our mental health that we might not realize at first, you know, how it can impact our mental health.
I just wanted to throw something out there real fast. Oh, go ahead.
Yeah.
One thing to keep in mind
You're
as
good, go
well
for it.
is whatever your experience is, and this is something that I've been preaching a lot lately because it's really needed, is that your experience, whatever it is that you're going through or whatever the situation ends up being is it's validated, period, because it's your experience, it's not their experience. And if you say that wasn't cool, it's not cool. Because one of the things that's the most difficult when it comes to dealing with the racism that's happening right now is it's one thing coming from a stranger. It's even worse when it's coming from a family or a friend, because then you don't want to like stand up to yourself, but you're also like, I don't want to hurt their feelings. I don't want to, and especially on social media. But now more than ever, it's really important to just call that out and say that isn't cool. It's not right, because that perpetuates that, and it does a disservice to them, because then it's like, oh, well, I could just totally say whatever I want to this person because you're my friend, you're my family member. But then on, like we're saying with mental health, it does a disservice to yourself, because then it's like, I keep allowing this to happen, but I'm tired. So just wanted to throw that out there.
Yeah, thank you, Dan. Yeah, thank you. That's a really excellent point, that it is really important to speak up, and really does tie into those 4 points, you know, we were talking about in the breakout room. So thank you for reiterating that. So this is a slide of a list of adolescent mental health symptoms. So adolescent mental health symptoms can differ from adult mental health symptoms. So I really wanted to highlight what those are, so that you're aware of what those look like in adolescence. So if you often feel angry or worried, difficulty sleeping or eating, losing interest in activities one used to enjoy, social isolation, I understand that one is probably a little more difficult to gauge right now because of COVID, but it, you know, is still a factor. Feeling grief for a long period of time after a death, use of alcohol, tobacco, or other drugs, hurting other people or destroying property, having low or no energy, feeling like you can't control your emotions, having suicide or harming yourself, or thinking your mind is out of control. And so these are all symptoms that are important to be aware of, and that if you recognize that you're having any of them or appears having them, it's really important to get help for any of these symptoms. So please keep that in mind. And then we wanted to do a little bit of mental health first aid. So we are both certified in mental health first aid. So similar to, you know, CPR first aid, they created mental health first aid to really help people going through like a mental health crisis. So these list of action items are directly from Mental Health First Aid America. So for action A, first, always assess for risk of suicide. You can have a risk of suicide or harm with a variety of mental health disorders. So always assess for that. And if the answer is yes, you need to seek immediate help. So that could be like if the person is expressing thoughts of not wanting to be here anymore, or again, thoughts of harming themselves, you need to get help immediately. So that, you know, would be things like taking them to the emergency room, or depending on where you're at, there are also psych emergency rooms, but that's only in certain part of the states. And then the next action is, if there is no immediate threat of harm, is to listen non-judgmentally. So if you're not in an immediate crisis, engage in conversation, ask the person how they're feeling, because this helps the person to get comfortable, and it helps to be an effective non-judgmental listener, and pay attention to your own attitudes and your own communication skills, especially any nonverbal communication skills that you might be giving off that might make them weary or not want to open up to you. And then action G is to give reassurance and information. So do not blame the person for the illness. Respect their privacy unless you are considered that the person is at risk of harming themselves, and provide them resources. And then action E is to encourage appropriate professional help. So professionals who can help include primary care physicians, mental health professionals, certified peer specialists, and psychiatrists. But typically a good place to start is to reach out to that primary care provider, and they can refer you to a psychologist or psychiatrist as needed. And then the final action, another action E, is to encourage other support resources like family, friends, faith communities, or support groups. And you can also discuss coping strategies. So discuss what coping strategies they have and help them identify other ones. So coping strategies can be even simple things like listening to music, going for a walk if they, you know, enjoy nature, or if they like to exercise, going for a run. It can even be just simple things like that, but helping them identify those skills that they have can help them remember when to use them, you know, in situations where they might be feeling anxious or depressed. And then now Vicki will talk a little bit about how adults can help adolescents who are experiencing mental health symptoms.
Catherine, do you want to just keep your slides up or should I share?
I can just keep them up and I'll just move along as you move along.
Okay, very good. Thank you. So how can adults help? And all of these slides really say the same thing. Be aware, be mindful, be informed, and be educated. And I think we're going to make these available to everyone as well. So understand the teen complexity. So understanding adolescent development is important. And some of those most important strategies in doing that is to learn about adolescent development and the reality of what's going on in the adolescents' lives today, and especially today. Seeking to understand those challenges and listening. Listening is one of the most important skills that anyone can have. And listening is an art. Being an avid listener and being able to respond in a supportive and non-judgmental way, restating or reframing things when you're working with your adolescents is so important. And then of course, seeking professional help if needed. Another piece as far as how adults can help is promoting physical development. And Catherine already touched on that when she touched on the E in agree as far as working on things that might promote that physical development, taking a walk, going for a run, all of those things are important things to do. You can forward, Catherine. Promoting cognitive development, cognition, asking open-ended questions to complex issues. So how did that make you feel? What are your thoughts about the racism that you're experiencing? How are those things making you feel? Also helping our adolescents think about what the consequences are of their actions. And this goes across the board. Encouraging healthy sleep habits, promoting injury prevention. So if you're riding a bike, wearing a helmet, those types of things. Forward, please. Thank you. Emotional development. Again, you see lots of communication issues through here. Encouraging and strengthening communication skills, building vocabulary, stress management. A lot of these things overlap, and you'll see that in this information. Nurturing self-regulation, helping teens carefully think about risky situations and having discussions about those ahead of time. How might you handle this situation? You know, provide a scenario and maintain that open dialogue. And for certainly adults, and whether you're a parent, whether you're a teacher, whether you're the neighbor, however you're involved, is that pay attention to those warning signs. And Dr. Houston, Catherine shared information earlier about those warning signs that your adolescent might be having some mental health struggles, if you will. And most importantly, if you are concerned about the well-being of an adolescent, you should really consult your provider, your support system, or mental health professional to help you help the adolescent. More social development, listening, acknowledging what the adolescents have to say, certainly setting boundaries and online boundaries. A lot of you spoke about TikTok and these different things. It's important to establish boundaries, and I know that when my children, I had set limits on the computer, so they couldn't search for certain things on the computer. There were limits as to what they could access. Again, good communication skills, and supporting your adolescent in sharing things that are concerning them. So they know that it's a safe place that they can approach you. And moral development, Catherine spoke about participating in faith-based programs and spirituality, and having those positive social ties does demonstrate folks with higher self-esteem and lower rates of substance use, which is very important. Next slide, thank you. So lastly, what can adults do? And I just put it in one big bullet point as far as what you have control over as the adult in this situation, and that is to talk honestly and openly about your values, to value every adolescent's unique identity, to listen and not judge, to support our adolescents in evaluating and addressing the results of their behavior and their actions. Let adolescents explore other perspectives, certainly as long as it's safe. One key thing I'd like to point out here is for us as an adult, making sure that we are taking care of ourselves. If you're not in a space where you're really taking care of your own emotional well-being and making that a priority, you're not really in a very good position to help others do the same. Practice realistic, healthy goal setting. Resolve conflicts with respect. So mutually respectful relationships that is addressing the issue and not blaming someone for the issue. And then lastly, managing your own anger. All right.
Thank you. And these are our resources. Just if you're interested in reading more about it, this is where we got our resources from, and there's some interesting websites that might be helpful for you. And then one thing I briefly wanted to add in was, so we mentioned a lot the importance of the social aspect and social emotional well-being. And with COVID, I realized that might be really hard right now, especially for those of you who do have class online. And so just thinking about how to get that social interaction right now, keep in mind, you can even talk to a friend on the phone or FaceTime a friend. And I realized that that might be a little difficult because sometimes we think, oh, technology is bad, and we don't want too much technology. And generally, yes, going on social media a lot can also have a negative impact on our mental health. But if you just set aside that social media for a little bit and really just engage even with a friend over the phone, I think with what's going on right now, that's kind of a good way to still get some of that social emotional connection. Or you could try going outside, maybe if your friend lives close to you, and walking apart from each other, and that could be another way. So I think it might be a little more difficult right now to get some of that social emotional connection, but you can find creative ways to still get that, because that is a really important aspect of our mental health. So just kind of want to emphasize the importance of that and finding creative ways to get that, still with COVID and everything else that's going on. So that's the end of our presentation, but we did want to open up for questions anyone might have, about our content, or maybe about some of the content from earlier, if anyone has any.
Actually, Vicky and Catherine, I do have one question, actually, either question or inquiry. Very good, very informative, and very timely. Mental health is really needed information right now. Now, from an educator standpoint, I mean, we all teach online nowadays. It's difficult now to really see whether your student is really struggling emotionally or mentally. And I've had those several experiences before. How would I know? From just looking at them online right now, I mean, a lot of the students do not want to have their video on, but then again, even if their video is on, how would I know whether they're really struggling? Because it takes away, like, let's say if I'm face to face with them, you kind of like have that interaction with them really after class or before class. But right now, there's limited interaction between me and the students. So how would I really know whether they're struggling, and how should I like incorporate, or what should I incorporate in my teaching strategy in order to address mental health with the students?
Yeah, that's a really good question. So a few thoughts that come to mind for me, at least at first, are definitely noticing if they're like showing up. I think in and of itself, showing up, right, is a sign. If they're not showing up, that could be a sign that there is something going on, or if they're not turning in assignments, that would potentially be a red flag. So first and foremost that. And then I think secondly, even just emphasizing and being a resource for them and just being open to them. I think if they see you as an approachable person, they'd be more willing to maybe share that with you. You could also potentially post resources for CAPS, or, you know, even at like a middle school, high school level, you know, the psychology department resources you might have in your school, as a way that they remember that those resources are there. So, you know, I have it directly posted on my Canvas site for them. And I think just even in your lecture, maybe at the end of class or beginning of class, just checking in with them and seeing how they're doing, and doing like an emotional, you know, check on them, like, how's everyone doing? You know, how is everyone's stress level? Is everyone stressed? And just emphasizing the importance of self-care. Vicki, do you have any other thoughts?
No, and that's appreciated. You wouldn't necessarily know, but not, is it Nina? Nina put a comment in the chat box. Nina?
Yeah.
Regarding doing a mental health check-in with her students, and that she actually utilizes a Google Form survey in her classes, doing a mental health check-in. And certainly you could even do so by putting that information in your syllabi. You mentioned CAPS and things like that. Letting folks know that if they're having issues, please, it's safe to reach out, and you'll do what you can to connect them with services that they might need.
Make sure everyone knows your office hours, and be clear that you can talk about academics, but also how they're feeling.
Yes.
I teach high school, and we do the Google Form check-in at least once a week, and it's been very helpful for some kids.
Oh,
fantastic.
Yeah.
That's great.
Mental health check-in.
And I appreciate everyone's, you know, willingness and recognizing the importance of this, because I think that in and of itself is a huge first step, just recognizing that you want to help the students. So thank you.
There's been a lot of discussion, a lot of things about because of COVID, and we're fairly quarantined, and we're trying to reach out as much as we can to connect socially, because that's, you know, that's who we are. We're social beings, that the effects of being connected through social media might do more harm than good. And so there's been suggestions, and I think about this when we talk, suggestions to disconnect from social media, give yourself a break from it, you know, try to set mindful goals, and maybe connect for just a couple hours a day to check in on folks or whatever, and then turn your notifications off on your phone so that you can disconnect from that information, and give yourself a moment to de-stress, if you will. Be mindful that the social media can cause stressors. Many of you talked in the breakout rooms about the things that you're seeing on social media.
Yeah, and I think that also ties in regards to advocacy and education and just educating others on everything that's going on and, you know, this political climate that we're in. Obviously that is really important, but even with that, we still do have to take care of ourselves because like we've talked about, that can have a huge impact on our mental health. And so even though that is really important work to do, balancing that with like self-care activities is important as well. So keeping that in mind is a good idea.
Any other questions, comments?
Yeah, Dr. Washington, I did have a minor question. You emphasized the importance of listening. I feel like this new climate of being online for students and teachers is hard to enforce like active listening. And I know there's a stark difference between the two. So how can teachers or students kind of really promote the whole active listening regard? I know keeping eye contact is one thing that people try to do in person, but it's kind of hard in Zoom when there's 50 different eyeballs staring at you. So how do you make sure that students are really taking in the information and utilizing it and able to conceptualize it?
That's a very good question, James, and difficult to answer based on those things that you have already said as far as being in a Zoom meeting and having, you know, 80 students on a screen in front of you. And when you're an individual who's lecturing, you don't see the students, you see the lecture that's in front of you. So it even removes that. So how do you engage in active listening? You hope that when you ask questions or you encourage dialogue, that you're able to hear those things and pick up on those things and have those real conversations with your students. And you can always come to office hours.
I can make a suggestion, breaking up lectures into 15 or 20-minute bites, and then polling or ask for interaction and pausing for questions invites interaction. So I don't think anyone just lectures for an hour and 20 minutes.
Thank you.
I think we're coming to the hour, and I just, you know, cannot believe that, you know, this runs so well. Again, this is our center's second time using the Zoom format to run this larger, relatively larger group kind of town hall or session workshop, whatever you call it. But I appreciate so much everyone is kind of, you know, opened and, you know, and our experts sharing their kind of information on very important strategies and early signs. And I think one of the things is that, you know, these information help us, you know, to kind of be support of each other. And like everybody said, it's a very difficult climate, and with everything going on, COVID or non-COVID related. But I think we just need to stand, you know, in solidarity and support each other, you know, teachers, students, parents, and even the larger community, right? You know, if, you know, and again, that thank you. And I wanted to play plug out there is that we, the CEDA's team, will continue to wanted to support every one of your work and what your needs. So we have a, we will send out a evaluation to your email box. Please don't ignore it. Please, you know, just let us know how you got out of this workshop and session. And also, please, if there's any topics or you wanted to connect it to our experts or a facilitator, you know, please let us know, and we will put you connected. And if you give us some suggestions about future workshop topics, we're happy, you know, to organize it and then put it out there. And since now we have you register through our kind of a platform, so we know you, then we will continue to let you know what our future workshops. And and again, that I think, you know, one of our partner, I want to acknowledge our co-sponsor partner, including API Vote Michigan and the CAPA, okay, Council of Pacific Asian Asian Americans, and then we have ACA, Association of Chinese Americans, and I hope I did not leave out anybody. And also MAPAC, it's a governor appointed commission, Michigan Asian Pacific American Affairs Commission, where I served 2 terms and got turned out. And it's still a wonderful kind of organizations that Roland also used to, and I were alumni now. And so important initiative, the census, right? The census still going on, and till October 31st, right? Richard, is at a time that the census, okay, so I was told that I need to remind everyone that, you know, to continue actively, you know, participate the census if you haven't, and then also the vote, you know, very important. All we talked about, right, just talked about is that we need to get our voices heard. And that's why this vote, this election becomes so important. So these are the 2 things that our partners, you know, just remind me to get the words out there. And again, that we like to thank everyone, and please stay connected with us and fill out the evaluation, and we will send you our future workshops. And we will do some raffle, and I know that you're filling it out not because of a raffle or whatever, but still, you know, there's some incentive, you know, help us to fill the evaluation. Let us know is anything that we could further improve and provide it to you. So that's it. I'm going to adjourn for this wonderful online session. Thank you, everyone. And I hope I will see you next time.
Thank you.